Are we supposed to be silent?
Absolutely. Well, hello, everyone. Yep, and if you're not speaking, you can put yourself on mute. Really excited and welcome to everyone for to this important conversation, advancing health equity through Black participation in Alzheimer's research. I am Carl V. Hill, Chief Diversity, Equity, and Inclusion Officer with the Alzheimer's Association. And on behalf of the entire association and Edie Yao, who's a director for diversity, equity, and inclusion, we welcome you to this important conversation. Why is it important? Well, we know that there are disparities that exist in Alzheimer's and other dementia, with African Americans being 2 times more likely than whites to have Alzheimer's or another dementia. So the need for research is critical. And so to conduct research, it's fundamental that we have participation, not only as researchers among Black Americans, but most importantly as research participants, so that we know that the interventions and the treatments are relevant, effective, and safe in our communities, right? And so we know that less than 5% of clinical trial participants for Alzheimer's research are Black Americans, and it's an urgent call to action that we do more to engage communities and have a discussion just like the one that we're having today. So we're excited to partner with the NFL Alumni Association, who's also passionate and very interested in doing more for inclusion. Black Nurses Rock, one of our partners, is certainly passionate and dedicated to this. And then one of our new partners that we are excited to work with and find ways to explore innovative pathways to communities, the Association of Black Women Physicians. And so with that, I'm hoping for a rigorous conversation today about how we can best align to get more representation, and maybe some new ideas that we just have not thought of when we get to the discussion. So I'll turn it over to Dr. Cozzette Lyons-Jones, President of the Association of Black Women Physicians, to moderate this very important discussion. So Dr. Lyons-Jones.
Thank you, Dr. Hill. It's a pleasure to be here with you all today. Again, I cannot say it more eloquently than you have in terms of summarizing the urgency and the need for having this kind of conversation. In terms of the agenda for today, it's packed and it's full of good stuff, right? We have, in addition to Dr. Hill, who is the Chief Diversity, Equity, and Inclusion Officer for Alzheimer's Association, we also have Dr. Charles Winden, Assistant Professor in Neurology, who will touch on memory and aging, and Mr. Jeffrey Greer, who will also be on the agenda. Black Men's Brain Health Conference will be spotlighted by our participant, Dr. Robert Turner from George Washington University. We have Mr. Lomas Brown, former NFL player, who will share personal story in connection to this cause. And then we'll have a call to action and after Tia Delaney gives us some information on how the community can become more involved in this. So that will be followed by a Q&A where your questions will be answered by our distinguished panel. So we have a lot to cover, and I'm excited about this day. So I'd like to introduce Dr. Charles Winden, Assistant Professor in Neurology from UCSF Memory Aging Center. And he will touch on clinical trials and the importance of having health equity embedded in the process so that we can achieve health equity for our communities. Dr. Winden.
Thanks so much. Let me share here. Okay. Can everybody see my slides? It should say discussion about brain health research.
Yes.
Okay, wonderful. If anybody cannot, please just let me know at any point in time. So I have a lot of information to cover, and I'm going to try to do so in a very quick manner, but one that is still fulfilling. So today I want to have an honest conversation with everyone about brain health research and why African-American participation in particular is really critical. To do this, though, I think we need to be honest about what has happened in the past. So this is a quote from Harriet Washington, who wrote the book Medical Apartheid. Some of you may have actually read it before, but it is physicians, patients, and ethicists must also understand that acknowledging abuse and encouraging African Americans to participate in research are compatible goals. History and today's deplorable African American health profile tell us clearly that Black Americans need both more research and more vigilance. I think one of the most important things for us to do during this meeting is acknowledge what has happened previously in this country with regards to the mistreatment of not only African Americans, but other groups in terms of research, and also talk about how we have moved beyond that and the type of research that is being done today and why it's so different from some of the things we may think of when it comes to research. So again, in this theme of just acknowledging the past, many of us are familiar with the Tuskegee experiments. Tuskegee experiments are often thought of as, some of the worst medical experimentation that was done, but we know that there have been other examples over the course of time. So Henrietta Lacks was an individual who died very young from an aggressive cervical cancer. She actually had a select group of her cancerous cells that were used by researchers, doctors at Johns Hopkins. These cells essentially were made immortal, meaning they don't die, they're here forever and ever. And they have really been the foundation actually of a lot of medical research. They have been incredibly important in terms of medical discovery. Other examples, J. Marion Sims, he really perfected a lot of OBGYN and gynecological surgeries on African-American women. And there was also Eugene Sagnier, who in the 60s exposed African-Americans and other socioeconomically disadvantaged individuals to high levels of radiation, oftentimes without their consent. Unfortunately, African-Americans really aren't the only group that have been impacted by medical research that has not been ethical. So we know, for example, that the US Public Health Department had STD experiments that were done in the 40s on Guatemalan prisoners. We know that there was significant experimentation during World War II in Germany on Jewish prisoners and also by the Japanese as well. During the Cold War, we know that the Soviet secret police actually did experimentation as well, giving different combinations of drugs and chemicals to individuals. And we know that there were Agent Orange experiments actually in the 60s where prisoners, again, were exposed to doses of Agent Orange 400 or 500 times the amount that really was deemed appropriate. So in the background of all this, you may be asking, well, all of these atrocities have happened. Why do we need research? Why do we keep doing this? Well, if you look at really the landscape of research and what it's brought us, it has dramatically increased our knowledge of disease conditions and helped us better understand how to treat them. So these are just 3 examples of some of the ways in which we used to treat conditions. So for example, smoking for asthma, something you would not think of is actually a way in which we used to treat asthma. Back in the late 19th century and early 20th century, we actually recommended that people smoke for the treatment of their asthma. This idea of plombage for tuberculosis, what plombage means is essentially you cause someone's lung to collapse. So previously, when we didn't know very much about how to treat tuberculosis, which is best managed by a combination of medications, they used to actually collapse people's lungs to try to treat their tuberculosis. Obviously, this is horrible in terms of treatment, and many people had bad outcomes as a result of this. And then radiation for cancer. Many of us know that radiation and chemotherapy are some of the mainstays, meaning they're the kind of foundation of our treatments for cancer. But until about 1903, we didn't actually use radiation to treat cancer. It was only after somebody tried radiation to treat a skin cancer that we started exploring this more. Okay, so only through medical research can we improve our medical knowledge and take care of people better. In addition to this, we know that the faces of medical research are very diverse. We know medical research has been done by a number of important individuals from a diverse set of backgrounds oftentimes, unfortunately, they have not received the credit that they're due. So some of the individuals pictured here, these are all famous African-American researchers. Patricia Bath, she was an ophthalmologist in New York City who really perfected a new treatment method for cataracts that were impacting a lot of the patients she was seeing. A lot of the patients she was seeing were going blind because of just poor treatment of cataracts. Solomon Carter is an individual who's near and dear to my heart, just because he worked under who many consider to be kind of the father of Alzheimer's disease. So Solomon Carter was an African-American, I believe, psychiatrist, actually. He worked with Dr. Alzheimer, who actually Alzheimer's disease is named after. And he wrote up many of the very first cases of Alzheimer's disease in the US. Jane Cook Wright, she actually is one of the earliest cancer researchers. She did a lot of her work in Harlem, if I'm not mistaken. And her work really led the way for chemotherapy becoming one of the mainstays of therapy for cancer. Again, many of us know radiation chemotherapy. We use them very frequently in cancer, but without the contributions of individuals like Dr. Cook Wright, we wouldn't actually be using them to the extent that we do. And then finally, there's also Dr. Lewis T. Wright, who is actually an African-American surgeon who was one of the first individuals to introduce vaccination, or the idea of vaccination, for smallpox, which used to claim a tremendous number of lives. So again, we know research is very diverse in terms of the researchers themselves. So we know there are a number of African Americans who have made significant scientific contributions to the world of research over the course of time. And this is just a list of a few of them. There are many more who are not listed here. What about protection? So I mentioned, there have been, unfortunately, a lot of there's been unethical treatment of individuals in the realm of research, but we've come a very long way. There have been a lot of developments. Many of them occurred particularly in the 60s and 70s. One of the most important ones that I want to highlight really is the Belmont report that came out in 1979. So if you remember your history, the Tuskegee experiments actually occurred in the 70s. The Belmont report came out after the Tuskegee experiments and really summarized and laid the foundation for ethical principles in research. The Belmont report, along with some of these other major documents, would give rise to the really important kind of protection mechanisms that we have currently in place to make sure that the things that happened in the past will never happen again in terms of research. Right. I've been using the term research quite a bit, but some of you may be wondering, okay, what does this actually mean? What does it actually mean when somebody is talking about research? I think one of the most important distinctions that's to be made, and one of the most important distinctions to understand, is there's a difference in research. So there are what are called observational studies, and there are what are called experimental studies, okay? In observational studies, researchers just observe what's already happening. So if you enroll into an observational research study, you may meet with a researcher who, talks with you about memory problems you're having. They may do something like a neurological exam. They may take or gather some blood work for you, but they're not actually giving you any sort of intervention. You're not getting any sort of experimental drug. They're not trying or experimenting anything on you. Okay, so this is observational research. This constitutes a lot of the type of research that we actually do. So this idea that I'm going to be getting some medicine or some substance that I don't know what's in it, in observational research, that doesn't actually happen. Now, in experimental research, you are given a treatment. So you are given a medication or a therapy to basically gauge whether or not it is effective in terms of taking care of or addressing the condition that you're dealing with. And we'll talk about kind of the different stages of this research, this experimental research. What is the most important thing to keep in mind about research in general? None of it can be done without your consent. Okay, so unless you agree to it, unless you agree to a specific part of the research project or agree to the research participation itself, nothing can be done without your consent. It's completely illegal, okay? Where are we in terms of brain health, and why are we talking about research in the context of brain health? Well, We know that brain health research has not included African-American participants by and large. The reason this is important is because as more discoveries are made and as we get closer and closer to potentially coming up with an effective therapy for Alzheimer's and dementia, if we don't have research that's representative of African-Americans, Latino individuals, other individuals who are not white, when these new therapies and drugs come out, there's no guarantee that they're actually going to be effective across the board in all populations. So this table here is just a list of 4 of the most important kind of research studies that have come out within the last 3 to 4 years. And essentially, all I want you to gather from this is that it has the people who have participated in these research studies have largely been white. And oftentimes we don't even know if they're Latino or not. So again, this idea that the research that's being done, it oftentimes just does not include other individuals. It's very homogenous, meaning the people who participate oftentimes are very much similar or the same. And so we can't necessarily say, well, these research studies are applicable or generalizable to other groups of people, okay? So switching gears a little bit, talking about a clinical trial specifically, what might a clinical trial actually involve? So you may have heard of phases of a clinical trial. So phase 1, the question is it safe? So phase 1 clinical trials usually include a very, very small number of people who may be healthy or have the condition of interest. Before a drug or a therapy even gets to phase 1, it usually has gone through extensive animal testing and extensive modeling to make sure that it's safe. But we do ultimately have to try in humans to see if it's safe. So phase 1 is just safety. Phase 2, does it actually work? So after we've found that the treatment is safe, we do a phase 2 to see, okay, does it actually do anything for the disease? Phase 3 is, well, how good is it compared to what we already have? If it does something for the disease, but it's not really that much better than what we already have, that may be a medicine that's not going to be very beneficial in the long term, okay? Once it gets through phase 3, meaning we know it's good in terms of safety, it works, and it's better than what we have, phase 4 is more of kind of the monitoring. So most drugs are approved by the FDA after phase 3. Phase 4, we kind of watch and see, well, what happens afterwards in kind of the real world. So some of the things that you might experience if you basically participate in a clinical trial, I will say that for most of the clinical trials that you do participate in, they're going to be probably phase 3, meaning the drug has already been proven safe. We've already proven that the drug has worked. Now we're just trying to see how effective is it compared to the other treatments. So a typical kind of workflow would be you indicate you're interested, somebody from the study team contacts you about your interest, you give your consent. So that's the first thing that happens. You have to consent. They screen you to see if you're appropriate for the study. And then you have some level of a baseline visit, meaning you may have a brain scan, they may do a neurological exam, they may do some blood tests. And then if you do get a medication as part of your participation, you get this medication at whatever interval is appropriate according to the study. Questions that you may have. How do I know my information is protected? All the information collected in clinical trials is kept in encrypted computers. It's kept basically under lock and key and filing cabinets. It's ensured basically in terms of safety. How do I know I won't be treated differently if I don't participate? Medically and legally, you cannot be treated differently based on whether or not you agree or refuse to participate in research. How do I know I won't be experimented on? As I said before, nothing can be done without your consent. It is illegal. If somebody does something without your consent, they can end up in jail, fined, etc. So nothing can be done without your consent. As I mentioned also, observational research is only just observing what's going on. It's not actually giving you therapy or treatments. How about some what ifs? What if I change my mind about participating after agreeing? You can stop your participation in research at any time for any reason. Flat out, period. What if I don't have money to participate? Most research studies, they cover all of the costs for research involvement, so you don't pay out of pocket. What if I have concerns? What if, something happens and I do have concerns? There is always an individual who's part of the research team or an individual who's part of a larger governing body who can address any concerns that arise, okay? So there's multiple layers of protection. I'm running out of time, but just briefly, there are two studies that may be of interest to individuals. One is New Ideas. This is a nationwide research study looking at individuals who have changes in their thinking and their memory. Through participation in this study, you actually have access to what is called an amyloid PET scan, where we can actually look and see where Alzheimer's proteins may be in the brain if they're there. Okay, this project is running through 2023 with an emphasis on inclusion of African American Latino individuals. The other study I want to mention is Find CTE, which really is for retired NFL players, age 45 to 74. You'll get different PET scans, which again, look to see, are there Alzheimer's proteins in the brain? Are there other types of proteins in the brain, along with blood tests and some other evaluation markers. And this is really for better understanding, how do we diagnose CTE and what happens in CTE? If you have any questions, I know that was kind of a whirlwind of material, but feel free to reach out at any point in time, call me, email me. Happy to answer any questions that have come up, and thank you all for your time.
Thank you, Dr. Winden. That was wonderful. Great summary. Want to just give a shout out to ABWP because Dr. Patricia Bass, who you mentioned, she had played a critical role in the advancement of ophthalmology and her research in cataracts treatment. She is actually a past member, mentor, and educator within our Association of Black Women Physicians, and she's being inducted into the Hall of Fame for researchers. Is a huge deal in May. So we're really proud of her, and thank you for mentioning her among those distinguished people who historically have contributed to the advancement of medicine, particularly for people of color. Next, we have Mr. Jeffrey Greer, Director of San Francisco Recovery Theater and Outreach Coordinator, Department of Public Health, who will speak to participation in research and clinical trials. Mr. Jeffrey.
Hi, how are you? Can you guys see me?
Yes, we can.
I guess you can hear me too. Well, I don't know. I'm taking in all of this information. I like that idea and concept of medical apartheid, and I'm going to definitely read that book. I don't really know where to start other than to say that, in a program that I have been and continuing to work with at George Davis Senior Services, my partner, Michael Bennett, conceptualized wellness in the senior Black community. Long story short, we had bingo going on. I was kind of one of the first. Dr. Winden came and gave a presentation. And through circuitous means, I ended up getting drafted kind of into the brain study. And I guess I was like anybody else, even though I had some knowledge, I was still very apprehensive. You want to know, but you don't want to know. But my mother suffered from Alzheimer's, and they called it dementia all the way up until the point where she stopped eating, and then they gave it a name change. But it all seems to be the same to me. Her sister died of what they called back then of a shrunken brain. But we know now that was really Alzheimer's. So I have an invested interest to kind of find out what's going on. I don't want any surprises. This is truly one of the ugliest and horrible diseases that exists to man. Hopefully we can find a way to get in the way of what are those things, amyloids or plaque or whatever. Love to talk to the NFL people. I think CTE, I think people who have had drug experiences, particularly crackheads, are suffering some form of CTE themselves. But that's another story. My main focus is that it was a freeing experience. I really felt as though I was contributing. I was participating in my own health. I think it's critical that we take the time to monitor, observe, and understand ourselves to the greatest extent that we can. I try to do everything I can to try to stem the wave, You know, we all want to stop the downward slide, and I got my brakes on full. But we also have to, or I had to take that step, that medical step. That's, when you walk into the hospital, all of a sudden, you look around and like, oh Lord, they're gonna keep me or what? But it was very welcoming. I must say the experience was enhancing. After the first hour, I would suggest a hand holding session. You better take somebody in there, people will run out. But it was really comfortable after a while. I didn't have any problem. I did all the stuff you see on TV. It was the little pictures. You got to put the words together, and then they ask you a question at the beginning of the hour, and then can you remember it at the end of the hour? All that stuff was actually a pleasure to actually participate in, because we see it on TV and we never actually participate. It never feels like that we are invited to the party. And, yeah, we're talking about Alzheimer's, and yeah, we're talking about brain health, but I want to be a part of it too. If I can get healthy, I want to stay healthy. So my experience was very positive, and I would urge and suggest anybody that has the opportunity to go on and take that step and, participate in the brain health. They may find, as my friend told me, there's a special negroid gland at the base of the brain that they don't know about yet. And, if the negroid gland becomes inflamed, we become very frightened and don't participate in society. So it's our goal to keep our inflammation down, and we have to be calm. I participate and teach Tai Chi in the community. It's something I picked up a long time ago. It's just another vehicle that I have found that kind of keeps my equilibrium. I was working in a theater, and went to go talk to a funder one time. It was an older white man, and I said, well, let's meet about 8 o'clock in the morning. He said, no, I can't do that. I said, well, let's meet at 10. No, I can't do that. Well, when can we meet? We said, I only talk to people after 11. I said, only after 11 o'clock in the morning? He said, yes. The rest of the morning is dedicated to myself. I don't leave the house unless I'm prepared. I don't talk to people unless I'm prepared and I'm comfortable and I've done everything I need to do. Then they get the most of me. And I thought about that, and it really made sense. Why not take care of yourself? Why not prepare yourself? Why not give the best that you can to people that we interact with on a day-to-day basis, whether it be patient, friend, lover, or just stranger? So that is that's why I participated. That's why I participated. And I think I got a lot out of it. I will continue on. If they call me back next year to do the follow-up, I'll be a part of that too. And I suggest that anybody who has an opportunity do that. So anyway, that's my story so far. If anybody has any questions, feel free, reach out. I'm always available and willing, and hopefully Dr. Wyndon and I can branch out in the community and get some more Black brains to study.
Wonderful. Thank you so much, Mr. Jeffrey. That was great.
Thank you.
Remember, we're doing a Q&A towards the end. You can start putting your questions into the chat box as we go along, and to help expedite the process. Just in case it's on your mind now and you just want to remember, you can go ahead and engage by putting it into the chat. Next, I would like to introduce Dr. Robert Turner, Assistant Professor of the Department of Clinical Research and Leadership and Department of Neurology at George Washington University. He will spotlight the Black Men's Brain Health Conference that is coming up. Take it away, Dr. Robert Turner.
Thank you. And I'm sharing my slides now, so hopefully everybody can see this. And I'm going to try to be as brief as I can so I can make sure that we get to hear from the other speakers, and then we have enough time during our Q&A. But I just right off the bat, I want to let you know that we have this brain health conference that's coming up on February 9th and 10th in Los Angeles. And it's during the Super Bowl week. So we just wanted to capture as many of the NFL athletes and alumni that'll be out there in Los Angeles. We're really looking forward to it. You see there the website address, mensbrainhealth.org. So we want to encourage people to go there. And my goal today is just kind of give you a brief little introduction about what's going to go on during this time. And it's a 3-year conference to advance the health disparities research. And really, we're interested in increasing Black men's representation in what Dr. Wyndham just said, and then what we heard from Mr. Jeffries. We have this huge need, and believe it or not, I'm sure it doesn't surprise many people, but Black men are even less represented than the numbers that we saw before. But on top of that, we want to have a better integration of Black men's unique risk and resilience factors in what we call biopsychosocial cultural models. And you'll see what that just basically means, a fancy word for the psychological, the biological, and the social influence on our health. And in this instance, we're talking about brain health. Our aims are really essentially to identify the knowledge gaps and future priorities that we have in Black men's brain health disparities. We know those disparities exist. We need both to understand what's going on today, and the more that we learn today, it will help us with our future priorities. We also need to cultivate a culturally competent workforce. What we hear over and over and over again, Black folks like to go to doctors and with other people who look like them, who understand where they're coming from, where their culturally are connected to. And what we have to do is we really got to play a part in increasing that pipeline and helping make sure that we have young people involved who want to do this kind of research. So we're both getting engaged with people and asking them to get into the research, but we need more people to do the research. And part of that is we're also building a national research registry for Black men. Mr. Jeffrey just talked about the registry for brain health. We need for Black men who want to be in all types of health-related biopsychosocial research. This is the first conference of its kind that really pulls together researchers, clinicians, healthcare providers, healthcare professionals, the National Football Alumni Association, very happy to have them as one of our partners. The Alzheimer's Association, please forgive the misspelling there. We have a sports marketing agency that I've worked with for quite a long time over the last couple of years who help us pull this together. We have academic partners, two of the best partners in the world, really, USC, they're in the Roy Ball Institute for gerontology, as well as the UC Berkeley School of Social Welfare. We're going to work very intimately and closely with community-based organizations throughout the state of California. And that really requires us to identify and work closely with community influencers, people who can go out and say, hey, listen, just like Mr. Jeffries this is a worthy cause to be involved. That's what we consider a community influencer who can say, I've done it, we understand how important it is, and we want to reach across the community, across the life course of young men and older men. So the program overview, the conference, as I mentioned, is for the next 3 years. We'll be in Los Angeles the first year. Then we go out to Arizona State with our partner in the Global Sport Institute and the university out there for a 2-day event. And then we'll be on to out in New Orleans. And our conference is really kind of twofold. The first part is really a participant science-focused event where we'll have formal scientific program, community engagement, and then talking about the research registry enrollment. But then we also, within that conference on day one, the second part of the day will be focused on a town hall meeting that will specifically work with the NFL Alumni Association. Will have lots of alumni involved. We'll have lots of athletes that are there. It will be a town hall meeting. We'll have lots of USC athletes. We'll encourage people from the whole community to come out. USC football program and athletes across Southern California who may be dealing with mental health issues, anxiety, depression, concussions. parents who want to know what's the real deal. How do we protect our our children and husbands? How do we protect people who are involved? And I'll just mention also that we're looking for more than just male athletes to be involved with that. Anyone who's playing sports, and really we care about their mental health, and this will be our time to listen to clinicians as to how we can support them. The program, again, you'll see real quickly, we focus on cognition, cognitive reserve, Alzheimer's disease, across the life course, risk and resilience factors, protecting your brain. And then really we're looking at this cultural competency of community-based strategies to work with individuals. And we have a unique aspect of this program is we have an emerging scientist fellows program. I'm so happy to announce that we've just selected our first 9 individuals to be in our cohort. And what we will be doing is teaching them how to do community-based participatory work where they're out in the community working with individuals, understanding the issues that are important to the communities and collecting this data from people. And so I can speak more to that, but I'll just skip on that. But just to let you know, we're really excited about the caliber and quality of individuals to help develop that next cohort of individuals who do this research. And then lastly, I'll just talk about our registry, our research registry, where we'll be on site and we'll be teaching people what a registry is, why it's important to be in the registry and all the benefits of that. And then we'll be maintaining that here at my home university at George Washington University. And we're so fortunate to be sponsored by the Alumni Association as a partner, the Alzheimer's Association, and receiving funding from the National Institute of Aging. And the last thing I'll close with is that diversity and inclusion is really important to us. So we have people from underrepresented cultural groups. We have plenty of women involved, even though it's called the Black Men's Brain Health. We do know that women play a vital role in men's health. And that's why we're really excited about having women there. And we just want to encourage all of you to come on out and be a part of this February 9th and 10th at our host academic partner institution at University of Southern California. And look at the website or contact me directly for more information. Thank you. Oh, and now I will introduce my good friend who I'm just getting to meet just the other day, Lomas Brown. We share the fact that we have played in the NFL together. Me, not so much as long as Lomas did. He had an 18-year career. I had about an 18-day career, but we're really excited to have Lomas with us. Thank you, Lomas.
Okay, thank you, Doc. I appreciate it. I appreciate you having me on this call. And I appreciate being in front of these distinguished panelists. You know, again, like you said, I played 18 years in the NFL. I played offensive tackle in the NFL for 5 different teams. I personally seen the effects of Alzheimer's, CTE, with some of the former players and some of my former alumni that I deal with. And, you know, I'm just so happy that you guys are doing the research, everything that you all are doing to bring this to the forefront, and, you know, all the medical advances are being made, because like you guys said earlier, it's a terrible disease. Personally, myself, after playing 18 years in the NFL, CTE is the one thing that I'm concerned with moving ahead in my life. I'm 58 years old. I don't think I've had any symptoms or showing any signs of the early onset of CTE or any of those other degenerative brain diseases. But, you know, as you guys know, that can turn, that can, you know, it can flip. So I'm very fortunate right now that everything is going well with myself. But like I said a little earlier, I have seen the effects of it. I am a co-guardian to the Hall of Famer, Lem Barney, who played defensive back for the Lions for a number of years. Lem is 73 years old, and he's been diagnosed with the early onset of dementia. and Alzheimer's. Lim had 7 documented concussions throughout his career. And I use the word documented because, you know, you really don't know in that game. You just really don't know if you've had concussions, if you're concussed a lot of times, unless you're not completely out. A lot of guys, they say just seeing stars. If you see stars, those are considered concussions. And believe me, I've seen plenty of those in my days. But just getting back to Lim Barney, and by me being the co-guardian for him, I could just see the effects that Alzheimer's and dementia is having on not just him, which is terrible to see, but his wife, Jackie, his kids, friends. It affects a whole lot of people. It just don't affect the person that has it or the caregiver. It affects people on the outside that care about these people and want to see them recover. It's a disease that I've seen Lim. I mean, the nicest person you want to meet, and you know, at the drop of a dime, he could be a person that you don't want to be around. Angry, you know, and a lot of different emotions that can run through them. So it is a terrible disease. I'm hoping with what's going to go on during the Super Bowl, as far as exposing this to more alumni, making this more presentable to alumni, working with the alumni group, that we'll get a big participation of ex-players that come and want to be involved with the program or want to know more about this disease, the effects of this disease, and maybe even some of the early warning signs that may be able to tell you if you have it or if you're going to develop it. I think the one thing that's really scary to me, as far as the CTE, is that you have to be dead right now before they know. I'm sorry, my alarm is going off in the house, but you have to be dead for them to diagnose you with CTE. And I think right now that's probably one of the more disturbing things, because again, you have to donate your brain, and there's so much that they have to do to find out whether you were affected with CTE. The other thing that's really kind of upsetting to me with the NFL is, as you all know, we had a concussion settlement that was decided upon with the NFL league. But as you guys probably know, there's been some controversy behind that because of the race norming that's been in the test that they've been given to players. African-American players start off at a lower threshold than our white counterparts. And, you know, again, that has come to light, and it's very disturbing to know that the NFL was using race norming with their testing of guys for concussion, for Alzheimer's, for some of the different things like that. So, you know, again, I'm glad you guys had me on this call. Like I say, I'm very happy to be learning different things about this. I'm happy about the steps that you guys are taking to help my little community, which I call the NFL alumni, our community. We need the help. There's a lot of guys that suffer in silence. There's a lot of guys, if you don't have a big name, you know, your name is not brought up. You're almost kind of like the forgotten child. And I just think every guy that played in the NFL deserves the same, deserves an opportunity, deserves to have a healthy life after football. And hopefully with the awareness that you guys are doing, with the programs that you all have set, with some of the things that you're planning on doing in the future, it'll help a lot more guys like myself, like Lim Barney, and some of the other guys that may be suffering in silence. So I really appreciate you guys having me on today, and definitely looking forward to being involved more and more with you guys.
Thank you so much. That's powerful. We appreciate what you're doing, Mr. Brown, in terms of using your platform to elevate the conversation into communities that may not have heard anything about the silent pandemic that's happening among African Americans. So God bless you and continue to do the work. Be strong. All righty, sweetie. Next, I would like to introduce Ms. Tia Delaney, Executive Director of Eyes of Love Nursing and Black Nurses and participant in Black Nurses Rock Foundation. She is also an educator for the Alzheimer's Association. Welcome, Ms. Tia Delaney.
Good afternoon, everyone. And thank you, Dr. Cozzette Lyons-Jones, for that warm introduction. I am so proud and thankful to be here as a representative of both the Alzheimer's Association and Black Nurses Rock Foundation. So thus far, we've heard a wealth of information related to Alzheimer's disease, clinical trials, and brain health. And we've even had the privilege of hearing first-hand details from actual research participants. So how does this information tie into nursing? And what role do nurses play in not only outreach, but getting the Black population to embrace and fully understand the significance of their participation in clinical trials and research? So here is a nursing call to action. According to Gallup polls, nurses have been recognized as the most trusted profession for the past 17 years and are perceived as honest, ethical, and compassionate. Unfortunately, this perception does not migrate into the healthcare industry as a whole. As touched upon earlier by Dr. Wharton, for centuries, Black America's view of the healthcare system has been distorted by their experiences of social inequalities, injustices, experiences of discrimination, manipulation, exploitation, and racially biased treatments that they have endured. Thus, with the nation's trust in nurses comes a huge opportunity and responsibility to take a leading position in delivering information on the importance, benefits, and value of clinical research to the Black community as a whole. Although we wear many hats, our core nursing values are rooted in honesty, integrity, human dignity, altruism, and social justice. So how can we as Black nurses not be at the forefront of bridging the health equity-related gaps that we both recognize and are faced with on a daily basis? So let's review some methods on how we can get involved in ultimately improving the health outcomes of our Black communities. 1, speak up and advocate for patients dealing with cognitive issues and play a role in getting them assessed and properly diagnosed, because that sets the platform for patient buy-in and a direct connection to how the disease is affecting us as a community. I often hear, if we are not seeing Black people being diagnosed with Alzheimer's, then why should Black people participate in research to develop treatments, interventions, and a cure for this disease? Number 2, educate. Every patient or family interaction, especially with our aging Black community, should be viewed as an opportunity to teach, not only about Alzheimer's disease and other dementias, but the importance of clinical trial participation and guidance on how to begin the process. Fortunately, one call to 800-272-3900 is a really simplified first step, because this will direct them to the Alzheimer's Association, where they will find a team of well-trained employees and volunteers to assist them every additional step of the way. We know that education helps patients to make informed decisions about their care, and as nurses, education is a significant part of what we do. So taking time to engage with our patients, listen to their concerns, and provide honest feedback regarding clinical trials and research can be both encouraging and empowering. And number 3, collaboration and support. Nurses have always been a part of a collaborative clinical team. However, this pandemic really reinforced the value of working together with our colleagues in our community to reach a common goal. That's the same energy we must put towards increasing awareness and involvement of the Black population in Alzheimer's related research and clinical trials. This entails working with organizations, churches, health plan providers, and other groups within the Black community. One of the major complaints of Black patients is that their care providers and community educators don't look like them and often can't identify with their lifestyles and cultural uniqueness. So our Black representation is both desired and necessary. However, because almost 15% of our nation identifies as Black, and less than 10% of RNs are Black, and less than 15% of LVNs are Black, this process may be perceived as a difficult task. This is where creativity must kick in. For example, have you ever thought about aligning yourself with a white physician and work together to educate patients about clinical trials and research? Or even working with non-Black social workers who interact with our Black communities on a daily basis. There are a lot of opportunities out there for Black nurses to make a difference in Alzheimer's research. We just have to be willing to take the initiative and get started. In closing, I'd like to address one final matter. A current saying in the Black community is that we are not our ancestors. And this rings true in all areas of our existence, especially healthcare. You see, Black people have demonstrated consistent resilience and the ability to persevere and survive through the most horrific tragedies of this nation's history. However, our ancestors did not have the freedom to speak their truths, let alone demand equitable access to healthcare-related services, resources, and care. But we do. Therefore, we must utilize the same resiliency of our ancestors and transfer it into empowerment by demanding that our concerns within the healthcare industry are heard, but more importantly, addressed. If we as Black nurses do not encourage and advocate for the Black community to have a seat at the table and be included in the research necessary to develop treatments, medications, and ultimately a cure for Alzheimer's disease, then we cannot be angry and upset when our Black patients don't have equitable access to those same treatments and medications and continue to have and experience poorer health outcomes than their white counterparts whose ancestors have always had the privilege of not only sitting at the table, but creating the seating chart. Thank you.
Thank you, Ms. Delaney. That was wonderful. We're going to go right into our Q&A, and there were a couple of questions that came into the chat earlier. I wrote down one of them, and it's being addressed to all of our panelists, so anyone can chime in from among our guests, distinguished speakers on the program today. One of the questions was from a Ms. Linda Johnson. In an experiment, how will the participants in the experiment know the medication that's being given is safe?
I'm gonna hop in and try to answer this. So I think it's important to keep in mind what we talked about in terms of phases of clinical trial, right? So phase 1 is the safety profile. So is the medication safe? So phase 1 trials, there is a subset of individuals. It's usually a small number of people who are in phase 1 trials just to see if the medicine is safe itself. Before it even gets to the phase 1 though, remember, there's a lot of animal testing and there's a lot of modeling that happens. So before we even introduce the idea of, well, let's give this drug to a human being, there's a lot of testing just to make sure that it's safe for everybody else. Computer models say it's safe, animal models say it's safe, et cetera. So phase 1, again, is it safe, right? And then beyond that, after you've established the safety profile, then we get into does it work? So that's phase 2, and 3 is does it work better than what we already have? So for most of us, if we were to participate in clinical trials, you're participating in a phase 3 trial or beyond, meaning the safety profile has already been established. They've already done the homework looking into, is this drug safe? So I'll leave it there for others to maybe contribute.
All righty, I think that was pretty thorough. There was another question in the box about how we can move the needle in terms of, let me go back up on here because it's moving. It says, no, it's because you're answering. You're all over the place, Dr. Winden. I love it. It says,
Sorry about
what's,
that.
yeah, no, that's a good thing. What specific cognitive assessments should we ask our primary doctor about in our annual exams as a senior? And what clinical trials are available for Blacks in the San Francisco Bay Area or nationwide? You can see Dr. Winden has already started answering that question in the chat. The most common cognitive assessments given by primary care doctors are the mini mental state exam or mini mental status exam and the Montreal Cognitive Assessment or MOCA. So I know CMS, the Centers for Medicare and Medicaid, annually require that myself as a primary care physician and others, in that field do annual wellness exams. And it's during those annual wellness exams that gives us an opportunity, because we get an hour, to actually get to know our patients and to talk to them, right? Go back to basics, right? And it allows us to be able to incorporate doing the mini COGS and mini mental status examinations. And so we're really pushing for that. And the Association of Black Women Physicians partnered with Alzheimer's Association for many reasons, but one of the reasons is to be able to get our physicians, our primary care doctors, to actually do the work in identifying mild cognitive impairment even earlier on in the course. You don't want to wait until the advanced where you really can't support the family as much and support the patient more significantly the earlier. And it's brain health is the same as heart health. So that many of the risk factors for cardiovascular disease are the things that are risk factors for Alzheimer's dementia, so in vascular dementia. So it's an opportunity for us to talk about health and food, and food is your medicine and all that, from the neck up and the neck down. So that was that question. There was another question that was put in the chat about pharma. I don't know if anyone sees that one because it's moving. Here it is. I work with many pharma companies who have made health equity in clinical trials and beyond a priority. How can pharma organizations overcome the distrust and fear of big pharma that may keep Black patients from participating in their trials?
One of the things, Dr. Lyons-Jones, I would say, is continued transparency in what's going on, the good, the bad, and the ugly. And also continuing to collaborate with those community organizations. You must continue to make sure that the people that are having those conversations look like the population that they're trying to serve.
Wonderful. Anyone else wants to add? And that would be our last question for this morning before we do our call to action.
Sure. I think I'll jump in real quick. This goes back to our community-based participatory research agenda that we're really focusing on, with the conference. And big pharma or anyone else who wants to do this work, they need to recognize that it takes time. You don't just say, trust me, and then show up into one or two events and then say, oh, I got to meet a few people, hand out some business cards, and then now we should be good. If you want to do this work, you need to recognize it may take years before you even get to the point where you can make an ask. It's all about showing that you are committed to being into the community. And so I think that that's the first thing, to recognize that it takes time, effort, and resources to really build the trust that it takes to move from there. And the last thing I just want to say, because I know we're over, but Dr. Guidry had asked in the chat, she said, are there any studies that she knows of that athletes could get involved with? She's, I believe, a wife of a former athlete or a mom of an athlete, something of that nature. And I just put in the chat that I am running another study, and you'll see it there. It's the Athlete Brain Health and Aging study that's funded by the National Institute of Aging. And we look at neurocognitive and psychosocial factors connected to cognitive aging and concussions. And would really love it if athletes who would like to be involved. The link is there, and you can contact me directly if you need to.
Wonderful. I actually have a former NFL player who played for multiple teams as a patient, who suffered from a lot of concussions, head injuries throughout his career, a young man actually with chronic headaches. And to watch how debilitating, he no longer can play, that ended his career actually. And, the repercussions is his livelihood, took a hit, and his family struggled. And so there's so much, there's a cost, to this, both to the patient in terms of their cognitive, losses and their physical health, emotional, but also to the family and the people that are connected to them. So for today, I wanted to, just offer to you all to really, take the information that was given to heart, but there are other resources, and I'm going to actually go into the chat and put up this call to action and invite you all to go and check out the Alzheimer's Association trial match for studies you may be eligible to participate in. You can go to alz.org/trial match. You can also call the Alzheimer's Association 24/7, their helpline at 800-272-9900 for free consultation and guidance on the dementia care and resources. Visit the Black Men's Brain Health Conference website. We want to put a plug in for that again for more information at www.mensbrainhealth.org. I want to leave you all knowing that you are empowered by this information that was given. I know it can be depressing to think about this, silent, pandemic among our people. We are, meaning Black Americans, are twice as likely to get Alzheimer's dementia as whites. And it's not talked about enough. And the caregivers are impacted, the communities that they're in are impacted. So we really want to say thank you to all those who participated on this panel on today and gave us food for thought and information to empower us to be able to go back to our communities and share it with our loved ones, and to even apply it to ourselves and encourage those who may not have thought about participating in research to actually look at it again. My husband was in the COVID trial study over UCLA for Moderna vaccine. And it's a wonderful experience. He answered the call because he saw in the news over and over again that it wasn't enough Black men that was participating early on in the research for the vaccine. And that's the reason why he stepped forward and said, I'll do it. So we need more people like that to really see that that information helps us, to be able to extrapolate and to care and to get to health equity, which is the goal. Thank you so much, and I'll hand it over to anyone else. I'm not sure, or am I the closer?
Thank you, everyone. I believe that is the closing of our program.
Yes.
Thank you.
Thank you. God bless you, everyone.
Well, it's been great. I hope we do this again. This really has been informative.
Absolutely. I know I have a radio show, just to give a plug, called Uncontrolled Substances on iHeartRadio. We actually are covering this very topic, Alzheimer's in the Black community. The forgotten pandemic is what I called it. And we have Petra Niles from Alzheimer's LA that actually would be a guest, and we have others that would be on. So that's another opportunity to get more information, to even to find out about the basics. What is this disease? How do we treat it? What's the impact on caregivers? What's the resources that are available? And we'll touch on research as well. So you are invited to listen, iHeartRadio.org. You can download the app. God bless you. Thank you, everyone.